you get panic attacks every time you hear the phrase new federal regulations. Well, we get to hear those phrases pretty often these days. So let's talk a little bit about 21st century cures. Are we ready for the information blocking rules and the API rules at this point? Do you feel like we're ready? And do you feel, what kind of impact do you think that's going to have on interoperability?
It's going to be interesting. I think there's the kind of frontline experience of this, which is not always easy to navigate. Like, there are people who don't want to learn about a life-changing diagnosis in the electronic medical record and not have the provider around. I think there's almost a generational sort of divide. I don't know what year it is. Every birthday that I have, I keep thinking, like, maybe I'm still on this side of the fence, but I don't know exactly where the line is. But there are people who legitimately don't want to get like unhappy news in the portal if it's there to help kind of frame it. On the other hand, there's many people who are like, I want my data. Like, it's my data, I own it. Like, it's not unlike a bank, right? If I deposit the money in the bank, I have a right to withdraw it anytime I want, and nobody should ask me any questions. I can use my money for whatever I want. And navigating that generational kind of divide, if you will, or at least that transition, is what I think the biggest challenge is in developing these regulations. That being said, overall, clearly the benefits outweigh, in my opinion, the benefits outweigh the costs as a society. But on the individual level, you want to make sure that every patient gets the respect and care that they need. And so how do you do that? How do you balance the greater good with like the individual needs of each patient? And that, I think, that's the cultural challenge of it. But personally, I've been a proponent for patients having access to their records. I think there's so much opportunity for interoperability and even just like patient empowerment, allowing patients to, once they have access, like a fully transparent, fully portable chart that they can take anywhere, then if they're not getting the service that they need at one hospital, they can very quickly go to another hospital for service. And I think it'll help drive competition, improve service, improve quality. So I certainly see why we're doing this year, but sort of figuring out the cultural nuances of this and making sure that you're meeting every patient's needs. It's kind of hard sometimes when you're looking at the big picture, and I've had patients like complaining to me that they learned about something that they didn't want to inside the portal, and you want to be sensitive to their requests. Like, everyone is important, and so navigating that is a lot of work and takes a lot of time.